Many of us find a strange satisfaction in cracking our necks. That popping sound, that feeling of release, can be oddly addictive. But this common habit is not as harmless as it seems. It can have serious, even life-threatening consequences. We crack our necks seeking relief from tension or just out of habit. What we might not realize is that we are putting immense pressure on delicate structures in our necks. One of these structures is the vertebral artery, a crucial blood vessel supplying the brain. Forceful or repetitive neck cracking can damage the vertebral artery, leading to a condition called vertebral artery dissection. This can have devastating consequences, including stroke. It's crucial to understand the risks associated with this seemingly harmless habit. Imagine a garden hose supplying water to your plants. Now, imagine someone bending and twisting the hose repeatedly. This can cause the hose to weaken and eventually tear, disrupting the water flow. Vertebral artery dissection is similar. It occurs when the inner lining of the vertebral artery tears. This tear can block blood flow to the brain, leading to a stroke. The symptoms of a stroke can be severe and include paralysis, difficulty speaking, and even death. Vertebral artery dissection is more common than many people think. It's often caused by trauma to the neck, such as whiplash from a car accident. However, even seemingly minor trauma, like aggressive neck cracking, can cause this dangerous condition. To understand how neck cracking can lead to vertebral artery dissection, it's essential to understand the anatomy of the neck. The vertebral artery runs through bony tunnels in the vertebrae, the small bones that make up the spine. When we crack our necks, we are rapidly and forcefully moving these bones. This puts pressure on the vertebral artery, increasing the risk of a tear. The repetitive twisting and bending motion of neck cracking can weaken the artery over time, making it more susceptible to injury. It's important to remember that everyone's anatomy is different. Some individuals may be more prone to vertebral artery dissection due to factors such as genetics or underlying medical conditions. Regardless of your individual risk factors, it's crucial to treat your neck with care and avoid any forceful or repetitive movements that could put your vertebral arteries at risk. Section 4. When a crack becomes a crisis. The dire consequences of dissection. Vertebral artery dissection is a serious condition that can have life-altering consequences. When the blood flow to the brain is disrupted, brain cells can be damaged or die, leading to a stroke. The symptoms of a stroke can vary depending on the area of the brain affected and the severity of the blockage. Common stroke symptoms include sudden weakness or numbness on one side of the body, difficulty speaking, confusion, vision problems, dizziness, and loss of balance. If you experience any of these symptoms, seek medical attention immediately. Time is of the essence when it comes to treating a stroke. The sooner treatment is received, the better the chances of minimizing brain damage and maximizing recovery. Section 5. Safeguarding your neck, prevention, and healthy alternatives. The good news is that vertebral artery dissection caused by neck cracking is preventable. The simplest and most effective way to avoid this risk is to stop cracking your neck. While it might be a tough habit to break, your health is worth it. If you're experiencing neck pain or tension, there are safer and more effective ways to find relief. Consider these alternatives. Gentle stretching, slow, controlled neck stretches can help relieve muscle tension without putting excessive pressure on the vertebral arteries. Heat therapy, Applying a warm compress to your neck can relax muscles and reduce stiffness. Massage therapy. A qualified massage therapist can use specific techniques to target neck pain and tension. Physical therapy. A physical therapist can teach you exercises and stretches to strengthen your neck muscles and improve posture. Remember, your neck is a complex and delicate structure. Treat it with care and avoid any activities that could put your health at risk. If you have any concerns about your neck health, consult with a healthcare professional.